We're going to dive right in. So this session will explore how public health professionals identify outbreaks, monitor trends, and implement interventions that safeguard community health. And this webinar will highlight practical strategies for coordination, surveillance monitoring, and health equity in both chronic and infectious disease contexts. So we're going to start off with identifying what disease surveillance is. Disease surveillance is the continuous collection, analysis, and interpretation of health data. So it's a cornerstone of public health practice for early outbreak detection. And this is something that while I was working as an epidemiologist when COVID happened, it was a learning opportunity for all of us, but it was something that was really important that we had to actually find the positive cases before they could spread, and it was important to find them early on, because if we're able to mitigate the outbreak early on before it can become an epidemic or anything like that, then that way we can save lives and more communities can be saved. And also this disease surveillance focuses on preventing diseases spread and improving population health. As I mentioned earlier, it's really important to detect the diseases before it becomes an outbreak, and it's very vital because it allows the identification of health issues before they cause significant symptoms or complications. And we can just draw back from that experience of COVID. I used to work with the long-term care facilities, specifically with the Colorado Department of Public Health and Environment, and we did work with assisted living, senior centers. So we just saw how crazy that was with the elderly population, and they're very fragile already, and it's easy for them to get the disease, and it was just very difficult to kind of manage that with them being very easy to get the disease, and also they had a lot of health issues. So that was a challenge for sure. That was a very difficult challenge, and I can definitely see that how I learned from that experience, and I'm sure a lot of us have learned as well. So some of the key goals of disease surveillance is detect and monitor disease trends, pretty much see where what the trends are going. Are we getting most of the positive cases? Is it in elderly? Is it in a specific community? Is it in hospitals? Are we having it in schools? So what is a trend like? And another goal is guide timely interventions. So the intervention has to be very early on. And another one would be support community health protection. So the most important thing would be supporting the community. How can we make sure the community is not being widely affected by the spread? And how can we make sure that we are saving lives and not people are dying? So pretty much if we're getting people that are having the disease, then they're not having a lot of symptoms. So how can we help people not get severe symptoms and the death toll? How can we decrease that death toll? So early detection and prevention. Surveillance helps public health respond before outbreak grow. And this is very important in epidemiology and public health, especially when we have diseases. And the focus wouldn't be on patient level data, but on recognizing patterns. So working as an epidemiologist, we did get a lot of information about, how many positive cases we have in a specific assisted living or nursing home, but it's really important to get those numbers. I can remember every week we had to actually get a line list, and a line list is pretty much it's a spreadsheet. It's a spreadsheet that has positive cases. So we get the names and date of birth and everybody that had a positive case. Every week we get a head count of how many people that tested positive, and we get their symptoms and all in their information, and also to see if they have been vaccinated or not for COVID. And it'll be our job to make sure that when we go to REDCap is another system that we use to monitor the cases, to make sure the cases are counted properly. So when we go to REDCap, we got to make sure that we are not putting patient level information. So we're just putting how many positive cases we got that week. We're not putting the names and all that and the date of birth. It's just the data. How many cases do we have of that week? And that way we can just monitor the outbreak for the period of 2 weeks. And if the period of 2 weeks we don't have positive cases, that means the outbreak has been closed and successfully succeeded. But if we get positive cases within that 2 weeks period, then unfortunately the outbreak will continue. So in the context of an outbreak, it's important to have confidential information in protecting the sensitive information of other people, of the positive cases. So we only share the information of individuals only if needed, and we do share that with the local public health authority and with the CDC. We do have to, share that information. But other than that, we have to make sure that health information is very, kept private because it's very important. Here we discuss epidemiology in practice. So it's really important to understand epidemiology. And it's not just about the numbers and the data, but it's also about understanding how diseases actually affect people in communities. We can do this by focusing on identifying patterns and causes of diseases. So it's important to know, like, why is a disease, like, why is this disease happening? Like, what causes this disease? Like, why are we having many people getting positive this disease? Like, what is the root cause of it? That's the most important thing when it comes to epidemiology. And I can actually draw back from that experience working as an epidemiology, working with Colorado Department of Public Health and Environment. We actually supported investigation for COVID-19 outbreaks, RSV outbreaks, and also for flu outbreaks as well. And they can both be, like, the three of them can be similar, but sometimes you can even have specific people with the similar symptoms, and they just have to be tested to make sure that they have the specific disease. So we have to first rule out what is it that they have, and that way we can actually be able to make sure not a lot of people are having this disease, so the disease is not spreading. Some of the methods that we used was interviewing, surveying, and also field investigations. So during that time, there wasn't that much field work that was done. So I was working remote. So a lot of my work was actually done remotely, meeting with the point of contact of the facilities. We were meeting on Google Meets, we're meeting on Teams and Zoom as well. So we're also like doing a lot of slideshows, presentations, and due to the changes of the CDC guidance, it was a lot of confusion. So we had to work with them very closely and just assist them with the changes and the guidance and with the isolation, and just make sure that they're understanding the guidance because it changes really frequently. So we did a lot of surveys with them. We actually had people that in Colorado, in the LPHA, the local public health authority, that were going in there and doing surveys because they were, still doing in-person field work. And we also did phone interviews with the clients, with customers, who are sick, with the residents. We did a lot of things. You can still do that, remotely, but the thing is, it just might take some time, and it's important to be patient as well. And another thing is just being collaborative, working with other individuals, working with the labs. Just make sure that we are working with other entities and make sure that we're getting the work done. And it's also important just to help other people understand our work and see what we were doing. Because sometimes it's hard when you're showing a graph, or some kind of like a graph showing like what's going on and how the numbers are, but it's important to also explain and discuss, like, this is showing this amount of numbers, like in this week this is how it's looking. And if we just give them like a website they can go to, there was a lot of resources. They can go to the CDC website, they can go to the Colorado Department of Public Health and Environment website. They can see each county, like what number they're on, like if it was on the red zone, like how are they doing and things like that. But it's also important to take time of our day to explain these trends and how they're looking. And the observation of trends without revealing individual data. Like I said earlier, information, clients' information is very important. So we can discuss the numbers, like we can say, example, like right now, Denver County is having a specific amount of numbers. Like that would, let's say, is an increase this week, 20% increase than last week. Things like that. Then people can see how it's looking, like how are the numbers are looking without giving any personal information. All right, sorry, I'm gonna put this down. Okay. So here we'll discuss how is information gathered. So it's important to count the positive cases and when there is a false positive. Sometimes positive cases that didn't wait the proper time period will retest and will show as a positive. So we have to make sure that we are collecting the right information in the right way. So pretty much we have to work closely with the lab and make sure that we are giving them the proper information, the correct information, the positive cases, and even the full name, the date of birth, all have to match. Example of what I'm talking about, it's like, let's say we have someone that tested positive for COVID, and it's like they are recommended to wait at least 5 days after the positive test result before retesting. Because if we retest within that 5 day period, like we didn't wait in a specific amount of time, we can still be positive, even though we're still trying to get finish with the symptoms. We can still show positive because we didn't wait the period. We didn't wait the period that it allowed for the virus to peak in the body and be like not deductible by the test. So we have to wait the amount of time that we are advised for isolation, for the symptoms to kind of go through. So it's 5 days. So that was something that we had to stress, I remember, because just getting positive cases, like being positive and then like retesting 2 days or 3 days after, that wasn't that's not appropriate, because it was messing up the test and cases and the accurate amount of numbers that we have. So we had to make sure that we're stressing that important. And also we, with the rapid antigen testing, that's the POC. It's something that it just really pick up quickly. It give a really quick result. And also it might miss the virus in people with no symptoms. So it's just something that we had to make sure that we stressed when working with folks. We also used red cap. So red cap is a disease outbreak. It's like a outbreak disease website that we utilized for positive cases, case counts. And we also utilize Epitrax as well, Tableau for like visualizations. So they're very helpful, not just to show data, but to also illustrate how they organize and visualize trends. Like I said earlier, it's important to have those graphs and things like that. You can show like how disease is going, but also it's good to kind of like, let's say, put a different color in there and show like, okay, this is how it's going, how it was a couple of weeks ago, and now this is where we're at. Color coding things, that helps a lot, because sometimes people will really like with colors, it really with red, that's caution. So it's like it just really draws your attention, and it helps you to really understand things. So now we'll just discuss the outbreak investigation process. So how do we do like disease like outbreak investigation? Like how does it work? So the first thing that happens is identify cases. And this is pretty much what I discussed earlier about the positive case. So we have to know that we have a positive case. And there's a clear definition that we have to utilize. With positive case, it has to be a positive case, meaning it's a confirmed positive case. That means that it meets all the definition, which is they have to have, example for COVID, they have to have symptoms, and also they have a positive lab test. That's a confirmed positive case. And we also have a probable case. A probable case, it's a case that meets some criteria, but not all. This can be like a person who has close contact to a positive case. Like let's say, you're positive and then you around other people, there are close contacts. And this is something we also did at, what is working as an epidemiology. It's like you, as an epidemiologist, you can do contact tracing. And I remember like even like the general population was very helpful with this. Like we'll call positive cases. We'll just, tell them that we're here to make sure that we are trying to trace, who would they were around when they were positive. And like a lot of people didn't even know they were positive. So, people were hanging out, doing things, and we just be like, okay, take me back, where were you? Who were you around? Who did you see? So that way we can try to catch people before they can go and be other with other individuals, and more people will be positive. So just that really helped a lot, because a lot of people were just like, oh yeah, I don't want anybody to get this disease. Like I want to make sure people are being cautious. And so they give us information, they give us who they were around, and they give us contact numbers, and we'll make our calls and, caution them and make sure they go get tested and isolate ASAP. That really helped a lot. And I think just looking back at that, how everybody was working together cohesively, coordinating together, that was a really positive thing. I can definitely draw back from. Going back to the positive, to the confirmed and probable cases. So we have one that's called suspected case. And suspected case, it's pretty much a case that, let's say they have some symptoms, but they didn't test positive. Like when they went to the lab, like they showed symptoms, but there's no lab information. They tested, they have symptoms, but when they go tested, they're negative. So pretty much they're like a suspect case. We can't count them 100% because they're not meeting that criteria of a confirmed case. So they're not going to be counted during the outbreak. So it's important. That's the number one thing that we have to do. Step one. Step two, we have to monitor the spread. So we have to look for clusters or unusual patterns. We have to see like what are people like, what are we seeing like more positive cases? Like, is it like, let's say example, like in a long-term care facility, like are we seeing positive cases like in like maybe like because they have different wings, like let's say like first or third floor, like let's say third floor, are we seeing more people getting positive in the third floor? Like is there like more people are getting positive, like what is going on? We have to see like why is it happening. Like there are more like get-togethers there, like anything's happening, like what's happening. We have to like kind of see like what's the trend and why is happening, so that way people can actually, in the long-term care facilities, they can see how they can stop that from happening. Like a lot of time, when they had a lot of events, different activities were stopped, gatherings, all the events at that time, they all had to be halted because of that. And it was difficult, especially for the residents, because they had to eat like in their rooms, and they were already isolated enough, and they had to be more isolated, and it was, messing with their mental health. And it was a disaster. But it's, people work together, which was really important. Step three is communicating with local agencies and facilities. This is important to, communicating with other agencies, local public health authorities, and the CDC. Sometimes, people like people cannot be in the same page. Because I remember it was very confusing, like how everything was changing rapidly. And so it's important everybody just to be in the same page, because, like example, the local public health authority, they have to give the same information that we give, to the public, because they have to match. We can't give different information because this is going to make people more confused, just, more chaotic. Things were just not going to, go properly. But we all have to be on the same page, so that way we are communicating the proper information for the public. So that way the disease is not, getting more, and people are not getting affected. The last step, which is recommending intervention, that's when it's really important for infection control to come in. Infection control of the facilities, I remember working with the infection prevention is there. They're just so amazing, and they're just from the beginning, they're just like, okay, we need to stop this. What can we do? Visitors had to be stopped. It's just those kind of interventions that you have to make, so that way you can make sure the residents are safe, and people are safe. Because if those measures are not taken, just the disease will just spread more and more and more, and more people will be affected. And vaccinations, this is important as well. People to be vaccinated, and the importance of vaccination. It's recommended for them to be vaccinated. They have different doses now. And now I think COVID, it's every year, it has to be, you have to be vaccinated. So, just educate people on that. And also just education about the disease itself is important. A lot of people, it was like new disease. A lot of people didn't know much about it. So it's like, you really have to like educate the public, educate people about disease and what is it that they're experiencing and the symptoms they're having. And that way they know, whenever like symptoms they have, they can be aware, okay, I might be catching something, then they can get the at-home test. They can get tested at home, and that way they're monitoring their own symptoms, and sometimes they don't even have symptoms. So you just educate people on that as well. Like if you don't have symptoms, like it doesn't mean that you're not positive, because you can be positive, but you don't have any symptoms. You can be asymptomatic. So things like that are important. Education, is very important because every day we learn something new. Now, so integrating behavioral health in public health. So I have a little, background in public health, in mental health, working currently as a case manager, and, working before as a case manager for a long time. So behavioral health and public health really like tie together, and it's important. It's important to really look at behavioral health and how that all of, work together. So behavioral health is deeply connected to, our physical health and public health outcomes. And just looking back at my experience as a, case manager, I can see like, and I saw how untreated mental health conditions, like or substance use issues, can complicate disease prevention, and management. Through behavioral health surveillance, we can also like identify emergent patterns. Those patterns can be like increased anxiety, someone having increased depression, or they're having some kind of like, or a community is having overdose trends. Like what's going on? It's important to look into that and inform early intervention. Like what can we do as a community to get to the bottom of this? Like there's something going on. So that way we can look into it in that, aspect is important. And collaboration between behavioral health teams, epidemiologists and community organizations also allow us to create more comprehensive public health strategies. For example, integrating behavioral health screenings into outbreak investigators, that's really important. Or even, chronic disease programs that use, that help us like address both medical and also social psychosocial needs. Yeah, it's just very important to look into that. The SDOH, social determinants of health. Like, what is it are we needing, and things like that. Like, are we needing access? Like, we need access to our healthcare. We need to see a provider. Do we need like what is it? How is that going to be affecting us as an individual? Is important. So promoting mental wellness and connecting clients to supportive services actually strengthen their resilience and help them recover faster. And it's something that I've seen in working, in behavioral health and also with infectious diseases. So behavioral health is an essential part of overall public health. Surveillance helps identify trends in mental health and substance use. Collaboration between behavioral health and epidemiology strengthens response. Case management bridges the gap between medical and social services, and promoting mental wellness support prevention and recovery in communities. Community collaboration and health equity matters. This is actually very important. It's something that's so vital to do. We have to have effective communication, make sure that we're working in a very timely manner. That way we actually get to work with other health, departments, community organizations, and clinics, which actually strengthen responses. And also promoting health equity. This is just understanding, like I mentioned earlier, social determinants of health. Like, are we looking at one specific area and seeing like there's a need, like let's say like food, there's food shortages, like these people really need access to food. Like, how is this affecting, public health? How is it affecting everything, diseases? Because people, if they're not eating properly, they're not having the nutritious food, people might become sick. That's going to be a reason that might for people to become sick and having diseases, right? So things like that. Just making sure people are having access to those resources is very important. And a lot of times I also notice some people don't even know the resources that they actually they have. Like a lot of times I find some of my clients not even knowing just some of the resources they have. Like some of them will just like be like canceling appointments, like doctor appointments. And I'm just like, why are you canceling appointments? You can call your insurance and see if you can actually have access to transportation to take you to provider appointments. Like you don't have to cancel. So it's just things like that. They were not even aware. So letting them know about that, letting them know about all these resources that can have through their insurance, through their health plan, just things that they can actually get. A lot of like elderly they can actually get. I think what is it called? I think something like a delivery service. They get this thing. It's like a spendable card every month. I think it depends on different health plans, but some of them that I worked with, they get like $80 every month. They can spend on things and they can buy diapers and things that they need, and even like it has over the counter stuff. So it's like just communicating that with people is very important. So reaching high risk and underserved populations, it's very important to work with those populations that are just underserved, not knowing what's out there, not having enough money to buy food, not having, the proper way to even get to those resources. Like they don't even have a car to get, food, go to the food pantry, get food. So just connecting them through those resources and just helping them, like this case management, they can have a lot of times they can have a case manager through their insurance. So just things like that, bridging the gap is important. Ensuring fair access to prevention and care resources. Every person deserve, a proper healthcare, proper behavioral health, resources, and then make sure that their needs are being met. It's really important and vital, no matter what their background is or anything or their ways. It's just very important to treat everybody as an individual and help everyone in need. So just some of the things that we can actually do as individuals. It's important to stay alert to patterns and unusual trends. So, just really know what's out there, like what's going on. Like it's important to just stay alert. Just know what's going on with a certain disease, or what the numbers are looking like. Just know what's happening. It's very important. That way we can actually make sure that we are safe and help our community become safer as well. Communicate clearly and early across teams. So this is something we can do, like it doesn't even have to be in a work, like professional work setting with our families, with our friends. Like if we hear anything, we can just make sure we let them know, like word of mouth from early on, like I heard this is happening, this is happening. So but also it's important to share the correct information. We don't want to share false info. So make sure that we're sharing the right information to them. That way they know what's going on and stay up to date. Collaborate. Even small networks make a big difference. Working in a community together, working on, with neighbors, with other people, right? It's really important, like if we see someone that might need help, just, help them and just communicate that with people, collaborate and just assist each other. It really makes a big difference. I know we can't save everyone, but if we can help our community, that goes a long way. Tools are just aids. So it's important to understand patterns, and that's the real skill. Like showing graphs, like I said earlier, like, like all these data numbers and things like that, it can be very confusing for a lot of people, but it's just important to understand the numbers, like having some kind of line that just goes up in a graph. I can see that, okay, this is going, like it's going higher, like this numbers are not going down, and it's going higher is a bad thing. So things like that will help. Like I said earlier, like having color coding, red, you can actually, if you do that, red is going up, like a line that's red going up, it's a bad thing. We have like maybe like grayish color going down, things are looking good. Things like that would be very helpful visual wise. So some of the lessons that I know that I learned, and I'm sure a lot of people have during that time, just timely communication. It's important to do that early on. It saves lives. So we have to make sure if there's something, and I know we all, it's something that we have to learn. If it's something that we heard, early on, make sure that we tell the public about it. Just having, that emergency communication, it's important. Data trends, inform decisions even without showing the data. So just make sure that we are having the information very easy for other people to read, for other people to understand, because a lot of times, everybody's different. Like whatever I can understand, it might be hard for another person to comprehend. So you got to make sure that it's something that we are sharing. It's very easy to another person to see and understand and comprehend. Partnerships, very, very crucial. It helps strengthen response capacity. So I saw this, working with, the CDC or with the public health department and communities actually allowed us to focus on resources and where they were needed the most. So as an example, like I remember a lot of the long-term care facilities were actually having shortages in like some kind of, like some of the, what was it? The PPE, the personal protective equipment. They needed more, like they were needing that like insane because it was an increased use. So they just needed a lot of like PPE and just kind of knowing from the beginning, okay, this is something that we have to make sure that these long-term care facilities are needing. It's vital. We have to focus on that. And another shortage I remember was staff. That was insane. Staff, because a lot of them were getting sick and they were positive and they couldn't come to work. So it was the staff was an issue. So staffing was a big problem and, definitely lesson learned. And just working together. And I'm sure now we can definitely, plan better for the future, but yeah, this definitely is a lesson learned for a lot of us. Health equity. So we should, must and should remain central in every step. Just make sure that we're working with everybody. Everybody's included in everything, and collaborating with others is vital. I think it's very important just to make sure that each person, even though like we have individuals that might not agree with a specific thing, but we just need to make sure that we have a goal that we are, working towards, and everybody has to just jump on board and try to forget about whatever you think is right, but like just right now, let's focus on this problem and let's try to all fix the issue. Here are just some resources that I utilized today for the presentation. And here, I just want to say thank you so much for having me today and being here for the presentation. And before I end, I want to just share these two words here, two sentences. So disease surveillance is about protecting communities through awareness, coordination, and timely action. Public health begins with awareness, grows through collaboration, and succeeds through prevention. And we can all make a difference and help and protect our communities. Thank you.
What a wonderful presentation. I so appreciate it today.
Thank you.
So, and there's some hearts coming up for you. Those are very well
Thank you. Thank you.
I've invited folks to put their questions in the chat.
Awesome.
So just really quickly, someone asked if you would be willing to share your slides. Is that possible?
Yes.
Or any other resources you might have? Wonderful, wonderful.
Of course.
So, because I just want to let everyone know that everyone who's here today gets a certificate of participation. That's going to go out via email. And once you were able to share the slides with us, I can put those into a format and share with everyone as well. So I also want to, there was a question, we've got some questions here in the chat and in the question and answer. And what I'll do is I'll say them out loud to you and you can respond to that.
I see here. Okay? What about community-based organizations? Yes, that's important. No, that was you.
That was me. So we have a question here from an anonymous attendee, and she says, thank you, Sama, for joining us today and speaking with us. What is your advice for someone like me, CHW? And I'm trying to find public health in the Dallas-Fort Worth area. I'm trying, after my AmeriCorps Vista service has ended under the federal government shutdown. She wanted to know if she could get your email address. So I guess in terms of like what advice you might have in finding this type of.
Yes. First, sorry to hear that. My advice for you is just be open to different opportunities, even though you might not think this might be the proper position for you or something that you see doing, be open to different opportunities. You just never know, you might try something, you're like, oh my gosh, I like something has to do with like data, like numbers. I'm like, oh, I don't like numbers. I'm not gonna apply. But let's say you do, and then you seem like you like it. So it's something at the end, you're like, oh wow, I'm glad I was able to, do this. Um, you know, don't be afraid to do that. Just have all your possibilities open, apply for everything that you even though you don't think you might be, interested in, just do, because you never know. And also try staffing agencies or contractor work. I actually found that really helpful in my experience as well. Yeah, because believe it or not, that epidemiology position was actually a contractor position that I did. And it was with the CDC Foundation. And then it was actually supposed to be for a year. And then because of COVID, it's just extended to 3 years. So do that. That's something that, sometimes we think, oh, it's 6 months, even though if it's 6 months plus, just apply. Just do that. It's it's helpful. You never know. You never know. And I wish you all the best.
If folks have any questions, they can also raise their hands as well, and we can do them live. And while we're talking, Kirsten asked if you could put your resource slide back up just for a few moments. So
Yes, of course. Let's see.
I guess I was also just wondering if you could um, just talk a little bit about folks who might say that something about maybe perhaps epidemiology in terms of tracking diseases is not important. How would you push back at that?
Oh, it's very important. It's because it helps us find those diseases before they even get to the general public, or let's say they got to the general public, but without having lots of lives lost, so that we can save more lives. We saw, with COVID, what happened. We lost lots of people lives were lost. And so if we're able to find, those people, help them early on before anything can happen, then we're saving people. More people will be saved. And why can't we do that? Epidemiology is very important, and it's something that will get to the root of the problem. Like, what's the cause of this? Like, let's try to find the solution. Like, why are we having this kind of issue? Like, what? Like, they just try to find a solution. It's not like a band-aid, but it's like finding the problem, finding the solution. And it's something that I just, and before working as an epidemiologist, I wasn't really like, when I got my public health master's, I actually had I had like the choice to even like, get it some kind of, what was it called? Like I think when you get your master's, you get an option for master of public health to even like concentration. I had the option to get a concentration, and epidemiology was one of them. But I'm just like, I just like never thought about it. I'm like, oh, I don't think I would like numbers and things like that, because math is not my favorite subject. Okay.
Mhm.
So when I applied, I'm like, oh wow, epidemiology, this is interesting. So it was, yeah, it had to do with numbers, but a lot of it, you work with people and try to like just try to really like be an investigator, really an investigator. You're trying to find like what's going on, what's the issue, what you're really an investigator. And I was like, wow, and I really enjoyed it. So it's just finding the root of the problem, and you just learn about how things happen, and like how can we stop it, and just really trying to find the solution from the beginning and early on, which is really important because it's all about, saving people, especially when it comes to an outbreak. And yeah, we're trying to, like not lose in like lives, like less lives. That's the goal. Like less lives have to be lost. That's the goal.
Wonderful. No, and I really love the idea of just that stress on um, storytelling and translating all this data for
Yeah.
the general public and how important that is in preventing outbreaks in the future. I guess we
Yes.
have a couple questions here. First, if in the chat, if you wouldn't mind sharing your email address, as folks really want to be in touch with you.
Of
Um,
course.
and someone asked, what forms of open access technology do you find useful in distance? I know you mentioned a couple of them.
Can you repeat that one more time?
Someone asked about like what open access technology software programs have you found most useful in disease surveillance? You mentioned like RedCap
Hmm.
and
Yeah,
that.
I found WebCap to be very helpful. And also like it's not really like that into like like tech. Like you don't really have to be like into like numbers and things like that. You can utilize it. Tableau, I did enjoy Tableau, but with Tableau, you kind of have to have some kind of like background in like visualizations and things like that. I would say WebCap is helpful. I know Tableau, you do have to have an account to utilize it. I think you have to have like a monthly fee or like maybe a yearly fee for it. Epitrax as well, but that one because it came with like the county, so I think you do have to have an account for that as well, and some kind of monthly fee for that too. Probably definitely try Tableau and see if you can get like a free some kind of like free use for that, like free trial or something for
Yes.
Tableau.
So I do know that they do have a free sort of light version that you
Hmm.
can use to test out if you've used it. Yeah, so I appreciate you sharing insights into that. We have another question. Someone wanted to know, thank you for your presentation. And just wondering if you could elaborate on how your team coordinated with external stakeholders to avoid duplication of services. Like what strategies did you use in forming positive collaborative relationships, coordinating action?
That's important. I think the number one thing is like when we work with other, organizations or people, we just have to, it's important just to really be humble. I think that's important because a lot of times, like we work with people and, you just don't want to like, because when we worked, with long-term care facilities, like them be like working, us coming in, they're looking at us like oh, they're coming to make sure that we're not doing anything wrong, and they try to not share anything with us, and they try to hide a lot of things. So from the beginning, I just go in there. I'll be like, okay, I'm here to help you. We're all going to be work together on this. We're working together. There's a collaboration. So it's important to stress the importance of that we're working together. There's a collaboration. We have a goal, and the goal is to prevent this disease from being more in the facility. So we're trying to make sure that less of your residents are having catching the disease. So let's just work on that, and just don't see other people are any less of you. Just we're all have something to share and offer. Like I worked with people that were actually like EDs and executive directors of the facility, and there had some issues with utilizing Excel. So that's not something to look down upon. It's like it's that's not something to look down upon. So it's you just have to make sure that you are working with people, and it's just something that I can learn from them, they can learn from me. And something that I did, just took time of my day and just to meet with them and just share my screen, and I was working on like Excel, like how to use Excel. And sometimes it's just really important to just be patient, be patient and just putting ourselves in other people's shoes, just relating to other people. But it's really important just to have communication, work collaboratively with other individuals, and make sure that we're all in the same goal. Like we all are here together. We're trying to get to the main goal, and just be professional. In anything that, like, let's say we experience anything while working with other individuals. I'm not taking anything personal. Everything is going to be professional.
So for your email address, is your Gmail address okay if I share that? Is it okay if I share that
Yes,
in the
like
chat?
their Gmail is good.
Yes.
Thank you.
And so I think our last question, we have one time for one more. Sadaf asked if you could share your most challenging experience in outbreak surveillance and containment other than COVID-19.
Yes, challenge experience in outbreak surveillance and containment with COVID-19. I would say for this, it would be during the same time, it would be flu as well. And at that time as well, RSV was one. But that was really challenging too, because with RSV, we like a lot of the symptoms were similar, and there was some confusion. People were like not sure, like what is it? Is it COVID? Is it or like what is this? So it was just like really confusing, and we just had to like tell them, okay, you gotta get tested. You have to get tested. But just stressing the importance of being tested, and just even though you have some of the symptoms that might be similar, you still have to isolate. I think that was one of the hardest, but I think COVID was the hardest. It was just the hardest. Like for me, yeah, it was the hardest because I don't know if anything can really be compared to that. It was tough. It was tough.
So I was thinking too, we have a couple of folks who have joined us today from Ryan White programs, in HIV work. And I was just wondering if you could speak just really quickly to how epidemiology can really find trends in disease distribution. So I'm thinking like, HIV and COVID-19 really impacted similar communities, um,
Yes.
created like basically a new comorbidity for those with HIV. I was just wondering if you could speak to that.
Yes,
Great.
yes, definitely. That's marginalized communities and things like that. It's because again, comes back to the important, like going to the doctor and being tested and things like that. So if you're not, going to the doctor as much, you're not getting tested, like we have the yearly evaluations and things like that, and there's a gap, then you don't know, about being, HIV positive. So, there's some gap here. So now it's like, okay, I'm not going to my doctor. I'm not seeing my provider. I'm not getting all this yearly tests that I'm supposed to be getting. And I'm not even aware of the symptoms of HIV. So, you know, then I'm not aware of it. So I don't even know that I have it. And I'm being with other people and things like that. So then more people are going to be positive, for HIV. So it's all about disease, prevention and preventing the disease before it happens. So it's important to, the HIV community, people who are HIV positive. Yeah, it's very important to just like educating them. It's education about the importance of getting tested. Even if they got tested this year, some of them are like, oh, I just got tested 2 years ago. No, you still got to be retested like every year, like and sometimes even more than that, just to know, because we can actually miss the signs, we can miss the symptoms. Sometimes it can be not even the correct symptoms. We might think we have something else, and so it's best to just get tested, and education is number one, is key. And having those communities, especially individuals that low income and things like that, it's affecting them the most. It really does. It's so again, going back to social determinants of health, meeting those people, meeting the community that's more affected, that's we know that might be at risk of getting those kind of diseases, and getting to them quickly and early on, and educating them about this, and helping them with the resources that they need, so that way they can get the preventative services that they need, so that way they're not catching and getting the diseases. So HIV, yeah, that's a big one, and it's something that actually we have to, I think, focus more on too. It's something that I think it's not really getting a lot of like lights on. It needs to be focused on. But I do see a lot of because also I work with the Dallas County Health and Human Services.
Mhm.
They do a lot of like health fairs and health screenings. So it's something that I see emerging, and I'm really happy about that. But definitely there's more of it needs to be happening. Like, And I think there's also HIV clinic too. Yeah, like a Dallas County HIV clinic. So they do a lot of work, and and Ryan too, they do a lot of work. So it's amazing work, but it's just we got to do more, and so that way we can get more people, streamline the process of people getting getting tested and getting to those free resources. Like there's free resources for people to get tested for free. So people knowing that, it's going to be reaching, more population.
Those, I think on that note, we will end here. I cannot thank you enough for your incredible work and for taking time to share it with us today. Very impressive. I can't thank everyone enough for joining us on the call, all the wonderful comments. Everyone's going to get their certificate of participation. We're going to be getting slides out to everyone. There's going to be a follow-up survey link. So I hope you'll share with us what you thought of today's presentation. And of course, if you are interested in joining, we have our special deal at vcph.org/elite. And again, thank you. Also, if you are at APHA, the American Public Health Association conference, I am here at the conference. Missing my badge. And please send us a message at communications@vcph.org. Perhaps we can meet up. We'd love to meet you in person. Always try to be accessible to all of our constituents. Again, thank you so much for an incredible presentation. Thank you for being here. And
Thank you so much. Thank you everyone for joining.